This is a hot topic right now, weight loss drugs, but not everyone fully understands what these drugs are, along with the risk versus the benefits of using them. Dr. Victoria Dooley from Northville Novi Family Medicine here to break it all down for us. Thank you for sticking around for us.
Absolutely.
You are hearing these conversations had at brunch tables across America. Girl,
Yes.
Are you taking this? Have you heard of this? My cousin has this. So many people trying to get their hands on this weight loss medication because it does seem to be working for so many people.
Yes.
But there are still some risks that we need to be aware of.
Absolutely. So with all things in life, medicine is risk versus benefits. We can't say, oh, something is 100% safe for you. But we can say the benefits outweigh the risk. And that's the same thing with weight loss medicine. So if you're taking some of these medicines for diabetes, it might have a lot more benefits for you because not only are you treating the weight, you're treating the diabetes. But if you're only taking it for weight, there are some real risks. Some of the minor ones being GI side effects, stomach upset, constipation, diarrhea. But a huge thing that can happen is it slows down your stomach, right? So what it can do is kind of like paralyze your stomach. And there are some small cases of people who have stopped the drug and their stomach is still paralyzed, which is miserable. You're not moving food, so of course you're feeling miserable. So that's one of the huge things that can happen. Another thing that we just noticed recently is one study came out in the past couple of weeks that said some people might have an increased risk of certain types of blindness on this medication.
Oh, wow.
But again, this wasn't like 10 out of 100 people. This was like maybe 10 out of 10,000 people developed this new form of blindness.
If you are just taking one of these drugs strictly for weight loss, you don't have any other real medical conditions, how long typically should people stay on a drug like this?
Well, it's a lot of risk factors, right? Costs. The costs are astronomical. A lot of insurances are going to stop paying for it. So if you can't afford it, you can't afford it. Ideally, you would probably take it for life because we do know after about a year of stop taking it, about 90% of your weight can potentially come back.
Okay.
The way it only acts on controlling some of our hunger hormones. When you're taking it, it gets out of your system in about a week. That's why it's a weekly shot. So if you stop it, all your old hunger cues can come back. But most people don't take it for life. Now, the more weight you have to lose, the longer you're going to need to take it to benefit. So can some people who can afford it stay on it for life for weight? Absolutely.
And you talk about also just the risk of obesity, and that in itself might be worth it then for somebody to start taking some of these drugs.
Absolutely. There's no such thing as healthy obesity. I say that because what we do know about obesity is that even if you didn't have high blood pressure, diabetes, it increases your risk of cancer. So breast cancer, colon cancer. So just having obesity with nothing else going on medically is going to increase your risk of cancer in the long run. So you need to talk to your doctor and determine if the risk of taking the medicine are going to outweigh the benefits of taking the medicine, because the medicine is anti-inflammatory. Inflammation wreaks tons of havoc on your body. So what we're seeing is it can decrease your risk of even heart disease in some people, which is phenomenal because we don't have a ton of things that can decrease your risk for heart disease besides, diet and exercise.
And it's also helping some people get pregnant. I was reading about Ozempic babies.
It is, even though you should not take it for that purpose. You should absolutely not take these weight loss shots with the intention of getting pregnant. You should not do that. But because it does reduce inflammation, because it does reduce weight, all those things are going to help you to get pregnant, absolutely.
How difficult would it be? I mean, I guess it just starts with having a conversation with your doctor. If you really want to be on one of these drugs, even for a vanity reason, is it, it's a conversation and then your doctor gets the final yes or no? Because there's so many things you have to consider.
I do believe that the medicine helps a lot of people. But I'm not going to tell somebody you need to take this medicine for weight only. So I have a discussion about the risk and the benefits, and if you weigh enough, I will make the decision to give it to you. I'm not going to give it to you if you're 120 pounds and you want to be 110, obviously. But we have to have a conversation about the risk and the benefits so you can make an informed decision.
And lastly, are you still facing shortage issues?
Absolutely, which is majorly affecting people with diabetes. So we need the people with diabetes to have priority access to the shots.
And Dr. Dooley, where can we find you?
DrDooleyMD.com.
Very good. We'll put a link on our website as well, fox2detroit.com. We're reading your comments after the break. Stay close.